Hey guys, this is Chris with the Easy EMT, and just wanted to make a video and talk about one of the things I get asked quite a bit is about passing the NREMT exam. There's a lot of confusion about the NREMT exam, especially if you've never taken it before, and there's lots and lots of vicious rumors about the NREMT exam. So I want to tell you, first and foremost, the NREMT exam can be a difficult exam, but it's not difficult for the sake of being difficult. It's actually designed to basically weed out people who don't need to be in the business of saving lives. Um, and the reason for that is we want the best of the best in our industry, and the NREMT exam helps to get the best of the best in our industry. And the way this works is it tests on all of the subjects that you learned during your EMT training. And the a lot of folks say, well, it's not written correctly, it's written poorly, and it's not true at all. It's one of the better exams that's out there, I think, personally. But about 33%, or about a third, of all EMTs fail the exam on the first time. So, but you got to think about that as it's not that the exam is hard. It's basically that a lot of students just don't take the time to study for it and don't take the time to prepare. If you will prepare, if you will study, it'll give you, if you will take these tips that I'm about to give you, it's really going to give you the best chance for being successful in the first time. So one of the main things is the NREMT exam is a computer adaptive test, also known as a CAT test. And the exam is going to be between 75 to 140 questions. Most people complete the exam between 75 and 120 questions. So what computer adaptive testing does is it's an algorithm, and it'll ask you a question, for example, about cardiology. And if you get the answer right, it may ask you another question about cardiology. If you get that answer right, maybe it'll ask you a third one, and it'll see if you actually understand the material. Now, if you get one of those wrong, it'll continue asking you questions to see if it was just a fluke that you messed up on a question, or to see if you don't know the material that well. If you don't know the material that well, it'll continue to ask you questions and it'll fail you out of the exam. So that's how it works. It allows you to be able to see if you really understand and know the material. So here are some test taking things that are going to help you not only on an NREMT exam, but on any exam that you take. So the first thing is don't cram. If you don't know the material the night before the exam or 2 days before the exam, you're not going to learn it. A lot of what we do in EMS is repetition. And what we need to do is make sure that we understand the material. And the best thing is to start now with studying, learning, and understanding material, because it doesn't matter if you cram and just pass the NREMT exam. What you really need to do is you need to understand the material, because at 3 o'clock in the morning when there's a cardiac arrest, you need to know the material. Absolutely, without a doubt. So don't cram. It's not going to help you any, and it's going to make your life a whole lot harder, because a lot of times folks who cram end up not doing well in the exam. One of the things that's going to be extremely helpful for you is to take practice exams. So for my students who are on the JB Learning software, there are practice exams on there. Take those often, over and over again. It's just like anything else. It's a skill. Taking the test is a skill, and the more times you take it, the better you're going to be. The more questions you're going to see, the more proficient you're going to be at taking the test. There's tons of test banks and study guides that are out there. I've got tons. Any kind of time I'm taking an exam or whatever, right now I'm working on the trying to get my CCP and my FPC right now, which I'm really studying hard for. And so I have tons and tons of testing material that's out there. I've got test banks, I've got study guides and examinations and everything. So take these exams. The more times you take practice exams, the better off you're going to be. So now let's get to the actual taking the test part. So when you're presented with a question, only read the question. Don't add to or take anything away from the question. One of the things that I see from a lot of students is that they will add to a question on an exam and be like, well, what if? It could be. That's not what it's asking you. It's only asking you what is enclosed within that question. Don't add anything from it. So only read the question. All right. So the next thing you want to do is to break down the answers. The NREMT exam is going to be a multiple choice exam. So break down the answers. A lot of times, on most questions, two of those answers are going to be completely wrong. Just take those right out. But two of them can actually both be correct. But find the one that's most correct. Even if all four answers are technically correct, find the one that is most correct. So you have to break down the answers. Once you've picked your answer, reread the question and see if it fits within that question and it's correct. So be careful. So it is time with those most correct answers. So look out for those change meaning questions as well. Those can be kind of tricky. So look out for questions that have answers that within the question that it has things like always, never, sometimes, or give anatomical things like anterior, posterior, normal, or abnormal. If you have a question that says oxygen is always to be used, that's that change question of always. So look for those as well. What are the other things you need to look for, not only on the NREMT exam, but other exams? Is it a critical patient? All right. So when we're looking for critical patients, when we're looking at a patient that's critical, most of the time it's going to be something with altered mental status, the patient's unresponsive, change in skin color, increased pulse, lowering of blood pressure, those kind of things, abnormal vital signs, is going to lead you to taking care of those primary three things that we need to take care of, which is airway, breathing, circulation. So those things always take priority. So if something appears to be critical, start looking for answers that involve airway, breathing, and circulation. One of the next things, the EMT is based off of the current American Heart Association guidelines. So know your resuscitation algorithm. So know what your rate is, what your depth of compressions, what your compressions to breathing is. Know the change between pediatric to adults. Know all those guidelines. They will be on that exam, so know them thoroughly. So one of the last things is about 85% of most questions on the NREMT exam involve adult patients. But remember, 15% are going to involve pediatric patients. So know the difference between pediatric versus adults, especially for resuscitation guidelines from the American Heart Association. Know what normal and abnormal vital signs are for adults and pediatric patients as well. This is going to help you a long way. So finally, some other things is before you start taking any test is be prepared when you get there. Get there early for the exam for the NREMT. Make sure you bring your ID. You're going to need 2 forms of identification for the NREMT exam. So make sure you have that with you. Get a good night's rest and make sure that you've eaten. Because you want that brain nice and have a lot of glucose up there to get you through the exam. Try to stay away from caffeine unless that's your thing, because it can make you a little jittery. The other thing is to make sure you use the bathroom before you go into the exam, because the NREMT is a timed exam and you don't want to lose time having to go and use the restroom. So make sure you use the restroom before the exam. And finally, relax. You either know it or you don't know it. So the main thing is to start studying now, learning the material, and you will do great. You're going to do great as an EMT if you study, because this is a lifelong learning. You're always going to be learning as an EMT, not only doing continuing education after you get your certification, but things continuously change in the medical field, and so studying is going to be part of life from now on. So guys, I hope you enjoyed this video, and I'm signing off, and we'll see you soon. Thanks a lot. Bye-bye.